Welcome, Kansas City, to your television show, Discovering Your Life Through Health with Debbie. I am your TV host, Debbie Vilchis, and this show is produced through Televida by Exofilms Studios. Today, we have an incredible TV program set up for you. We have not only a good friend of mine, but also he happens to be an incredible dentist here in Kansas City. And so, without further ado, Michael, welcome to the TV program.
Thank you, Debbie, for having me.
This is so exciting. I feel like there's so much misconception between dentistry that just getting the information out to the public is going to be wonderful. So thank you for being here.
Of course, I'm glad I helped.
Okay, so I want to start things in the beginning. Tell us a little bit about what put you in the pursuit to be a dentist.
So I knew I always wanted to help people. I wanted to be a doctor of some sort, but growing up, we took care of our grandparents, and I was always in the hospital with the grandparents. Is either my grandma or my grandpa who was sick, and I was just tired of being in the hospital setting. So I decided I did not want to be a physician anymore. I wanted to be a pharmacist as well, but I also wanted the social aspect, and there's not much social interaction with patients. So I looked at dental offices, and I like teeth. I've always liked teeth. Blood doesn't gross me out, and I really like dentistry. So, yeah, it's worked out so far, 5 years and going strong, so, yes.
That's awesome. I feel like it's a perfect profession for you. You have beautiful teeth.
Well, thank you. You do as well.
Thank you.
No more braces, I know.
I've had work done by Dr. Flores, so.
Looks good. Looks very good.
Thank you. So do you mind telling us a little bit about what your schoolwork was like in dentistry, just in case we have anybody out there that's trying to pursue that profession?
Of course. So I went to St. Louis University, did my 4 years in undergrad there, and it was very rigorous. I was told from professors I would not make it into dental school.
Wow.
So it was very devastating. I thought that I was not going to be a dentist. I didn't know what I would do with my life. And luckily, I have a very supportive family that was there for me and told me to persevere. My parents did not go to college, but they were there for me, and they kept motivating me. I did graduate from St. Louis University with my degree in psychology as a backup plan, just in case I did not get accepted into dental school. But I did. I moved back to Kansas City, and dental school was more stressful, I'd say. Basically, all of the 4 years all the classes I took at St. Louis University, we took that, condensed it into 1 year at UMKC School of Dentistry. It was very just long nights at the school studying, and then with the board exams, trying to find your own patients, and then the stress of just graduating on time was very stressful. But I graduated May 2016, and I have been practicing for 5 years in Belton, Missouri.
That's wonderful. It does sound super stressful. I remember going through school and being like, I don't envy people who want to be dentists. It's just a lot of schoolwork.
Well, my mom wanted me to go further and become an orthodontist, but that's 3 more years of school, and my kids can go further. Let's just say that.
Right, your kids can do more than you can.
Yes.
You're like, you can strive to do more.
Exactly.
I love that.
Thank you.
What was some of the schoolwork like in school for dentistry?
For dentistry, it was a lot of science. So it's a lot of science, a lot of studying, a lot of memorization. And then second year, that's when it came on with the teeth. And it's like a whole nother language, just learning about teeth and just understanding it. But there was a lot of lab work as well, waxing teeth, drilling on teeth, working on teeth upside down with a mirror. So we worked on mannequins, and then once we progressed and passed that part, then we worked on live patients. So that was very scary. Third and fourth year was just we all learned from each other. I had 115 classmates, and we were all very supportive of each other.
That's awesome.
So,
oh, I love that.
Yes.
I love that you guys have a little community.
We do. It was very competitive, but at the same time, we all helped each other out because we're all going through it at the same time.
Right. I feel like that's what creates that community is that you go through hardships together and you also celebrate successes together.
Correct. And I still have great friendships with my classmates.
That's beautiful.
Thank you.
Well, tell us a little bit about your daily life now. What is being a dentist like on a daily basis?
Being a dentist, so I have Mondays off, which is awesome.
You don't have the dreaded Mondays?
No, I don't have the dreaded Mondays. Now I have the dreaded Tuesdays. So,
it's a new one.
But I work Tuesday through Friday. I'm pretty busy those 4 days. I come home tired. My stress reliever is going to the gym and just trying to relax and take care of my mental health. Patients going to the dentist, it's not a fun time. I hear on a daily basis, patients hate coming here. So I just try to make it a more pleasant experience for those patients, because at one point I did not like going to the dentist. I was traumatized as a kid and I just grew out of it. So I try to make that experience more pleasant for my patients.
Oh, that's beautiful. Yeah, I definitely feel like a lot of people have that fear. I mean, they even make songs about fearing the dentist.
They do. I was scared of dentists in the dark, so yes, it's...
If you don't know that song, look it up.
Yes.
That's so funny. So tell us a little bit about maybe some of the normal procedures that you overcome.
Okay. So if I'm not looking at patients as far as doing their exams or new patient exams, and I am treating patients with fillings or crown and bridge or extractions, we do a lot of teeth, pulling teeth in Belton. There's just a lot of patients aren't educated on how to properly take care of the teeth. So my main goal is trying to save teeth so we don't have to discuss dentures, because going over dentures in the process is a whole life-changing experience, and we want to try to keep that natural smile.
Yeah, absolutely. Leading to that a little bit are there techniques that maybe our public and our community can learn from that can be a preventive source for cavities and possibly not having to pull your teeth?
Yes. So I would highly recommend brushing your teeth twice a day, in the morning for at least 2 minutes, at the nighttime for at least 2 minutes, and just make sure you're also flossing. If you're brushing 2 times a day, if you're flossing, you're going to be disrupting that plaque buildup, that bacteria, and that's definitely going to improve your home care. On top of that, seeing your dentist, every 6 months for a regular checkup, getting x-rays, we can prevent cavities leading into bigger procedures, turning into root canals, crowns, or if the tooth no longer is savable, then we have to pull the teeth and then talk about replacements, which actually replacements is more expensive than actually keeping your tooth.
So what you're saying is if you actually take care of your teeth by brushing them, the dentist shouldn't be that expensive, right? Because I feel like you hear it all the time, like, dentist is so expensive. I mean, I probably said that a few times. But yeah, so it shouldn't be that expensive, right?
If you're on top of your brushing, flossing, going to the dentist regularly every 6 months, then no, the dentist, it should be an enjoyable time and also not an expensive time.
Wow, I love hearing that, because that's something that I think people need to hear out there. It shouldn't be expensive and it should be enjoyable.
And it should be fun, yes. We have a fun time when you come visit the office. The whole team loves you.
Oh, I love that. Thank you.
You're welcome.
Okay, so I do want to talk a little bit about mouthwash.
Okay.
I feel like you hear all the time of utilizing mouthwash, that the more the merrier. But tell us, what does mouthwash actually do, and does it even help?
So mouthwash is helpful. It is beneficial as far as it freshens the breath. It does have fluoride in it, but it only will remove the soft plaque that is on your teeth. So if it's pretty loose, it will remove that. It's not going to remove the tenacious built up plaque that has accumulated over a couple years or so. But the best thing is the brushing and the flossing. So the mouthwash I would recommend in addition with the brushing, the flossing, but it's just going to loosen the soft plaque.
Wow. Okay. It's good to know.
Yes.
I always thought it just refreshed your mouth.
It freshens the breath. It has some benefits, but the brushing, the flossing will be the best thing.
Okay, now talking about flossing. Are you a water floss kind of person, water pick,
Okay.
or are you like a traditional flosser?
I do both. So
Overachiever.
I do
Overachiever.
recommend for my patients, if my patients are in their habit of flossing regularly, if they do not have any cavities, if their gums are healthy, then stick to your routine. If patients are saying I'm flossing and their gums are not reflecting that, then we need to talk about a water pick. And a water pick is a device that releases pressurized water, and it's twice as effective as manual floss. So I am an avid person of the water pick water flosser. It does wonders. The research proves it. But like I said, if you're flossing good, if your gums are good, if your teeth are good, then stick to your normal routine.
So you should probably put a water pick in your Christmas list.
I always tell people for their Christmas list, birthdays, it's, everyone's asking about it. So sorry, sarcasm, but I tell the kids all the time, everyone's asking for a water pick. And I'm like, oh, really? I'm like, yeah, you need to get it. So.
Yeah, and I feel like it's just more convenient and it's easier.
I'd say it makes flossing fun.
Yeah,
so
that's true.
It's a little messy, but once you get the hang of it, then you will enjoy flossing.
Okay.
Yes.
Okay.
So I would give it a try. Do you have one?
I have one.
Okay.
You converted me to it a while ago.
Also, if you have any braces or if you have implants or bridges, that water pick is going to be much helpful as far as cleaning your gums and your teeth.
Okay, I love that.
Yes.
Okay, so in the lines of braces and Invisalign, which would you think, or which do you prefer for your patients? Or is it case by case?
It's a case by case, really. For some patients, they have mild crowding or spacing, and it is achievable with Invisalign. However, there is quite a bit of crowding or spacing where it's too difficult for Invisalign, and for the patient, it would be best that they get the brackets and the wires. Invisalign is quicker. It's not as noticeable.
For sure.
However, it is a case by case selection.
Okay, so not everybody, if you have a super crowded mouth, you probably should always get Invisalign. Okay.
Correct. But I always tell patients, just make sure that your oral health is excellent, because whether you do braces or Invisalign, if we're not doing a good job with the brushing and the flossing, and then we put something in your mouth that's going to trap that bacteria, it's going to be more harmful in the end.
Absolutely.
You'll have straight teeth, but you'll have cavities. We don't want that. We don't want that. Yes.
All right, so this next question is kind of for my personal usage. I drink a lot of sparkling water.
Me too.
And I am just curious to see if that has any negative side effects to your teeth.
So that's a good question. It's sparkling water. It has been very, very popular recently. I personally like sparkling water. It is more acidic than regular water. So that's the only bad thing with the sparkling water is the acidity. As far as the sugar, there's no sugar in there. So it's much better than drinking a Coca-Cola or Mountain Dew. Mountain Dew has the most amount of sugar in it. So dentists hate Mountain Dew.
Can you tell when somebody drinks a lot of pop?
Mountain yes,
Dew?
we notice when patients are drinking a lot of Mountain Dew or energy drinks. Energy drinks
Really?
Causes a lot of destruction. It's very acidic, very sugary, and it causes a lot of problems for patients. So sparkling water, you can stick to it. It's okay. We would much rather you drink sparkling water than soda pop or energy drinks.
Okay, so if you need a little booster for energy, you just need a little bit of coffee.
Yes.
And black coffee probably is the best.
It will stain your teeth. So
it will stain your teeth,
yes.
But I think that's better than getting a cavity, right?
That is better.
Okay.
That is better. But just make sure that the sparkling water does not have sugar in it, because some of these sparkling waters do have sugar now. So you just have to kind of read those labels.
So sugar is the culprit.
Sugar is the culprit that causes cavities, correct.
Okay, noted. So
Yes.
once you do get a cavity, most people get toothaches. What
Not
does
necessarily.
that mean, or what is a toothache even?
So when I diagnose cavities on patients, patients will be like, I have 5 cavities? Like, how is this possible? My teeth don't hurt. And that's what I'm here for. My job is to prevent these teeth from hurting you. If it gets to the point where we neglect to get those cavities taken care of with fillings, then they will start to become symptomatic. They will hurt you, and it will turn into a bigger procedure like a root canal or a crown. Or if the tooth is no longer savable, then we have to pull the tooth and then talk about replacement options. So a toothache is when the bacteria has got too close to the nerve, and that's when it starts to hurt you. So we try to keep patients away from toothaches in emergencies.
Okay, noted.
Yes.
How often should a person go get their teeth checked, and x-rays maybe in addition to that?
Very good question. So if you have healthy teeth and if you have healthy gums, you should see your dentist every 6 months for a cleaning, for exam, and for x-rays. However, some patients do have gum disease. Gum disease is more prevalent in the Hispanic population, the Asian population, and the African American population. So if you do have gum disease, it is recommended that we see those patients every 3 to 4 months so that we can make sure that the gums don't get any worse, make sure that the bone doesn't start to decrease, and to also make sure that the gums, the teeth don't become more painful. So if you're staying on top of your oral health, every 6 months for a cleaning and exam. If you do have gum disease, you need to be seeing your dentist every 3 to 4 months.
Wow.
Yes.
I feel like that's so enlightening.
Yes.
I know I've met a few people. I won't name who you are. But they go to the dentist maybe once a year.
Oh, no.
And I'm just confused about how, please tell me your tips on how you keep your teeth so clean and so beautiful. Because I feel like if I don't go to the dentist at least a couple times a year, I have, like you said, developed a cavity. And I'm just like, I promise you I'm keeping good, clean health hygiene on my teeth.
Yes, just make sure you're not going once a year, because you can. I know with the pandemic coming on, or we're almost over with the pandemic, but it was very hard to get patients in. But we did have patients who were over a year, and then they ended up needing a deeper cleaning, or their fillings turned into crowns and root canals, or we couldn't save the tooth. So by neglecting us, it is going to cause more issues in the future for yourself.
Absolutely. So that kind of prompts this question of, how long does a normal cleaning usually take if you're in for your traditional cleaning?
If you're taking care of your teeth and you're going regularly, it should take about 60 minutes for your cleaning, for the exam, and for the x-rays. However, if you do need that scaling and root planing, it will require myself or my hygienist to anesthetize to make sure you're fully comfortable. And that appointment could take between an hour and a half to 2 hours. We want to make sure that we are removing the plaque, the bacteria, so that we can make sure that the gums and teeth are healthier.
Okay, so there's a different type of cleaning, like the deep root cleaning.
Correct. So if we aren't seeing patients every 6 months, if patients aren't doing a good job with their home care, then it is possible that they would need that deeper cleaning.
And that probably hurts.
You're going to be numb.
Okay.
But we try to make it comfortable for you.
Okay.
Yes.
So is it an option to go into a dentist and consistently ask to just be numbed, even if you're going in for like a routine checkup, if they're just looking at your teeth? Is that an option?
Yes, it is. So I do have patients who have high anxiety. They prefer to be put on the laughing gas, the nitrous oxide, or they prefer to have a numbing agent. And we will definitely do whatever you would like. We want to make sure that you are comfortable. So if you need to be numb for your cleanings, if you need that nitrous oxide, that laughing gas, then we will provide it.
That's so sweet.
Yes.
Do you provide snacks as well?
No, we don't. We provide water.
And not CO2 water, not sparkling water?
No, just regular water.
Oh, man.
We don't provide any snacks. We do have a toy chest for the kiddos. But,
do you see kids
no
as well?
We do. I see kids from 1 to 90s.
Oh, so, wow. Yes. I didn't know that you could go into a dentistry office and have children as well as adults.
Yes. So basically, we do recommend after a child receives their first tooth, so 6 months to maybe a year, They will come in, and it's called a knee lap exam. We will examine to make sure that home care is looking good, and also make sure that there's not any infections or any concerns. We want to make sure that parents aren't sitting their kids to bed with bottles with milk or orange juice, because that does contain sugar, that does rot away the teeth. So there's just a lot of education that we need to inform the parents and also just the community about young kids.
Absolutely. Touching up on that, I feel like a lot of parents often think that because their children that's small will be losing their set of teeth, that it's not super important to keep their hygiene. You know, there's, I feel like, a little bit of a misconception there. So what do you say about that? Like, is it super important to keep your young teeth, or if they're gonna fall out?
So it is very important to keep your baby teeth. If the teeth are, and we do see this where the teeth are no longer savable, we have to remove them. And yes, you will get adult teeth in the future, but if you're losing teeth at 7 years old, you won't get your adult teeth probably till 11 or 12. And that's going to become an issue where your arch, the top or the bottom arch, will start to collapse, and there won't be enough room. And then it causes a lot of crowding for the adult teeth, and that's when it turns into most likely braces. So we do try to educate parents and the kids to make sure that we're brushing to get those sugar bugs off. We call them sugar bugs for the little kids.
I love that.
And we also send our kids home with a timer for 2 minutes so that they know that they have successfully cleaned their teeth for those 2 minutes. But we try to stress the importance to make sure that we're brushing those teeth and flossing those teeth at a young age. Otherwise, it can cause a lot of pain for the kids, and we want to make sure that they aren't traumatized and at a young age.
Yeah, wow, that's interesting, because I do feel like everything always starts when you're young. Those traumas hit when you're young, and then they transform when you're older.
They sure do. They sure do.
Yeah, well, I'm glad that you guys are thinking about the kiddos.
Of course.
What's the youngest age that usually you see? Like, can you see babies?
I saw a 6-month-old last week, actually.
I would consider that a baby.
So 6-month-old, we always, like I said, once a baby receives their first tooth, we recommend, the American Dental Association recommends that you see a dentist to make sure that home care is good, and then we can educate the parents on how to make sure that we're keeping healthy teeth and healthy gums.
What is a home care? What does that mean?
Home care is just making sure you have a toothbrush. A soft toothbrush bristle is going to be the best thing for you. Please try to avoid using a medium or hard bristle toothbrush.
Really?
It is more destructive on your teeth, more destructive on your gums. That's when you start to notice gum recession. That's when you start to notice that the tooth loss is becoming more prominent. So soft bristle toothbrush is what is best for your teeth and your gums, and floss as well. So just make sure you have that. That's a normal home care routine, and your teeth and your gums will be healthy.
Wow, I did not know that. I feel like I have been using the wrong toothbrush my whole life.
So my whole life, I used a medium toothbrush myself, and then I got into dental school, and I realized that the toothbrush companies were just making profits because Americans love choices. So when they go to the toothpaste aisle, they see soft, medium, hard, and they're like, oh, well, maybe medium or hard will clean my teeth and my gums better. It's wrong. The soft is the best thing for you. The medium, the hard is causing more harm. So I learned the hard way. I have some areas of my gums have receded from aggressive brushing with the medium or hard bristle toothbrush. So yeah, I wish I could. If I could tell a lot of people, I tell my patients all the time to use a soft bristle because they will ask for a medium hard bristle toothbrush, and they are upset that we don't have it, but then I educate them on the benefits of the soft bristle.
Wow, that's incredible. I mean, I'm still just taken back about knowing that little bit of fact.
Do you have a soft or medium?
I have medium.
Oh, okay. Well, we'll change that for you, okay?
Well, you give me it.
I have one in my car, okay?
Okay, so you do give out toothbrushes to patients.
Of course,
correct?
Yes.
Well, that's great.
We give out toothbrushes to patients, and then we give them out to the community. So we have a lot of leftover toothbrushes, and We just want to make sure that patients, people in the community do have access to a toothbrush and to a toothpaste, because I'm not sure if you're like me, but after I brush my teeth in the morning, I feel so much better. So
yes,
it all
it's
starts,
like my happy place.
Yes.
Brushing my teeth makes me feel good.
It is.
Right? And I feel like so often teeth is the first thing you see, even
Yes.
though people don't say that.
Well, I mean,
That's what you look at.
it's been kind of weird with the mask lately, but
True.
before mask, teeth is what everyone sees. The smile, the teeth, it's what everyone really just looks at. So.
Yeah, and so something that I would like to touch up on is the fat of teeth whitening. Is there a specific maybe method that one could use that is not so terrible on your enamel? Or is there something you recommend for people that are trying to get that whiter smile, that drink a lot of coffee?
Yes, of course, of course. As far as teeth whitening, everyone is talking about teeth whitening. Everyone comes into the office and they're not concerned about all the cavities or the gum disease. Their main question is, how can I get whiter teeth? I always want to make sure we address that the teeth and the gums are healthy, because teeth whitening, it is very abrasive on your teeth. And it can cause more sensitivity, it can cause more harm. So if you are a coffee drinker, tea drinker, if you're a smoker, I would try to use like a Crest 3D white toothpaste, and then you can use some whitening strips. See how you like that. There are other options out there, such as whitening strips or in-office whitening, but it is more sensitive on your teeth. And basically what teeth whitening is we're dehydrating the tooth structure, we're dehydrating the enamel, and that's what gives it the whiter appearance. So I always tell my patients, try out the whitening toothpaste first. Just make sure that the whitening toothpaste and the whitening strips is okay. And if you're still not happy with the results, and if your teeth are not as sensitive, then you can try the whitening trays, or you can try the in-office whitening.
Okay, so what you're saying is start slow,
and then you can progress. Exactly.
But no one should have a white smile overnight.
Correct. It takes time. It takes time.
That's probably the healthiest way for your teeth, huh?
Exactly. And I would also recommend, so if you're just using a whitening toothpaste all year round, if you're not switching it up, it is more abrasive on your teeth and your gums, and your teeth will become more sensitive. So if you're happy with the way your teeth are looking after you're using your whitening toothpaste, then I would go back to a Crest Pro Health or a Crest Gum Detoxify or a Colgate. We just need to kind of make sure that we're fluctuating back between the whitening toothpaste and a regular toothpaste that contains fluoride.
I love that.
And I said fluoride because fluoride is what keeps the teeth strong and healthy. If you're using a toothpaste that does not contain fluoride, you are more prone to get cavities, and that will become more expensive. So.
Yeah, so let's save some money, Kansas
I'm
City.
trying to save some money for you. Use a fluoridated toothpaste and use that soft bristle toothbrush, okay? And floss.
Well,
and see your dentist every 6
awesome.
months.
I feel like all of this information is so useful for our Kansas City community to make sure that we have healthy, beautiful smiles for the rest of our lives. And so just to finish up, do you mind giving us maybe your email, contact information in case anybody in the audience would like to contact you?
Yes, of course. My email is mflorez@mydentalmail.com. And you can reach me at 816-885-2240. My office is located in Belton, Missouri. If you have any questions, you can call my office at 816-331-1900. And I would just like to say, I always tell my patients this, if you stay true to your teeth, they won't become false to you.
And thank you, Dr. Flores, for joining us today and discovering your life through health with Debbie Vilchis. Kansas City, it's been an honor to join you today, and I hope that we see you next week in our next edition.